Welcome, 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 everybody. Please just remember, got the t-shirt sign up here for those of you who celebrate one of the winter holidays. And we all celebrate New Year's, right? You can get your t-shirt and hand it out. I'm really excited today. I'm Amy Cohen, clinical psychologist. I lead SMI Advisor, which is one of SAMHSA's funded centers to try to provide technical assistance to the field on serious mental illness. And I'm joined today by Jacqueline Seitz, and I'm really excited about her talk. So, we've got a lot of news, everybody's talking about 988, which is great. There was a whole thing on privacy this week. Notice our usual here on who's participating and watching. What I want you to know is that these YouTube watches are growing. So if you're not here on Wednesday, which I love for you to be here on Wednesday because I don't like to talk to myself. But if you're not, we have over 70 now on YouTube. So if you're new to the Jam and you want to hear what we've talked about in the past, or you want to search, go watch us on YouTube. We've got some great ones there. And our bottom one here on threat assessment and response just jumped into the top 5 specifically because of the YouTube watchers. All right. This is me too. I looked actually in April and my Crisis Jam is not on there. So if you're like me, go back to the Crisis Jam website and download the event file so that you've got us, because we don't want to miss you on any of the Wednesdays in 2023. All right. And, the website, I always like to put in a plug for the website because I use it often. You can see who's coming up. You can get the Zoom link. You don't even have to have the calendar invite. You just go there on the day and see the Zoom link and jump in. But all the background stuff, what have we recently been talking about? What are some hot quotes? What was the most recent hot seat? So definitely come and visit the website. All right, so we've had a lot of news lately. I don't know if you guys like this, but I know that myself and others like popular science. I love end of the year summaries, just in general. New Year's is my favorite holiday. And this one is always good because it's got some real funky things that came out in 2022. And guess what's in the top 100 greatest innovations? 988. Very excited to see us in there. So that was super news. So check it out if you have a little downtime over the holidays. Pretty excited about it. Oh, our own Tina Orwell here showing us the new option for the license plates, 988 Lifeline. There is hope. I love that hope is bolded there. Tina is always, well, first of all, she's one of our top jammers, but also, did one of the first 988 fee legislations. And we're just so proud of all the movement that they're doing in Washington. Thank you, Tina. All right, many of you probably heard about the outage on the phones on 988 this week. Good news was that people were still able to text, but yes, it got a lot of traction this week around the shutdown. This is a quote that we really like. In an effective crisis system, perhaps the most potent element of all is relationships. To be human, to be compassionate. We know from experience that immediate access to help, hope, and healing saves lives. And this is a little bit of an old quote from 2020 from the national guidelines, but I think it's really relevant to our new focus on the Jam, which is really what is the experience of the caller and how can we make it feel like care? And so really liked this as a reminder for all of us on our new kind of mission and vision for the Jam. So I want to invite forward Jacqueline Seitz. She is from the Center of Excellence for Protected Health Information, which is a SAMHSA-funded center, similar to SMI Advisor. And she's also from the Legal Action Center and is the senior staff attorney for health privacy there. Jacqueline, welcome to the Jam. We're so happy you're here.
Great, thank you. And hello, everyone. I'm happy to be here. So my name is Jackie Seitz from the Center of Excellence and Legal Action Center. The Center of Excellence is a free national resource funded by SAMHSA that provides all sorts of resources about the federal health privacy laws for substance use disorder and mental health information. We are funded by SAMHSA, but nothing I say today represents SAMHSA's official opinion or guidance. Nothing I say today and none of our resources constitute legal advice. And I'll have more information at the end with my colleague Michael about how to contact us and get more resources about the federal health privacy laws. So as we get started today talking about privacy considerations for 988 and crisis response, please feel free to put in the chat any privacy questions that you're bringing with you today, or just share a bit about what brought you to the session today about privacy. I think it's helpful to start with thinking about why privacy matters, and particularly why privacy matters for people seeking help during a crisis. These are the three main ones for me, but would love to hear from other people if you think I've missed a major one. First, privacy promotes access. In the next few slides, I have a little bit of data that shows the way that a perceived lack of privacy or confidentiality can really be a barrier to people who need mental health or substance use disorder treatment. Second, privacy protects against escalating interventions. And this is important both in actual terms and in terms of community perception. 988 is being promoted and understood as an alternative to 911 and law enforcement. If people want police on the scene, 988 is probably not their first call. And so no matter where you stand on the question of whether or how to involve law enforcement in crisis response, I think we can all agree that law enforcement response has some risk of harm to the individual experiencing the crisis. And there's a very strong equity issue here as well, because Black, Indigenous, people of color, trans individuals may be at greater risk of a violent or carceral response. So this is a major equity issue and also a patient safety issue. And then last, privacy centers an individual in the decision-making. If you recognize someone's privacy right, you're really recognizing their autonomy to make their own decisions and sort of trusting to a certain extent that they are going to make the best choices. And so it's an important part of patient-centered care and sort of recognizing all of our own autonomy and right to make decisions for ourselves. Stay on this slide for just one more second. Any additional considerations that I missed? I'm looking in the chat and I see some good questions that I'll make sure to address in a second. I think that in addition to promoting access to care, you could also say that privacy promotes quality care. It's better for both the patient and the provider if there's a sense of confidentiality and the patient feels free to share the information that they need, the clinician gets the information they need. And then the other reason why privacy is important that I didn't put here, but that I think will be a through line throughout my presentation and many of the presentations for Crisis Jam, is the relationship between privacy rights and stigma. There's still so much stigma against people with any sort of mental health condition, people who use drugs, against just drug use generally, against people with substance use disorders. And privacy rights really help protect people against that stigma by putting them in control of when and how to share information. And then before I move on, I also want to acknowledge that there are a lot of competing considerations for 988 and crisis response. It's not all about privacy. And I'm not saying that these are the only considerations or that these are necessarily always going to be your top considerations. But I do think it's useful to start teasing apart what we mean when we say privacy matters and think through the different considerations and be able to articulate and identify them. So that's what I'm saying today. This isn't a pitch for, privacy or nothing. But I'm just hoping that we can sort of help fill out the conversation a little. So let me quickly go through this data and then I'll address the questions in the chat. So this is from the National Survey on Drug Use and Health. As you can see, this is from the most recent one. So these are the 2020 data points that were published in 2021. Among adults aged 18 or over who responded, 13.7% said that they needed mental health treatment and did not access it because they were worried that it might cause their community to have a negative opinion. So that's stigma, right? That's like concerns about stigma and discrimination and criminalization. Another 10% said they were, or it's not another because I think respondents could choose more than one option, but 10% also said that they were concerned about confidentiality. That's why they didn't get treatment or they didn't want others to find out. For individuals with serious mental illness, SAMHSA broke those numbers out and they were each respectively higher for each of these responses. So for individuals with serious mental illness, each of these privacy and stigma related concerns were a more frequently reported barrier. And then on the next slide, we have the similar statistics for substance use disorder. So similarly, for individuals ages 12 and up who needed substance use disorder treatment and did not access it in 2020, 11.9% said that they didn't access it because they were concerned that it might cause their community to have a negative opinion, and 6.5% said that they didn't want others to find out. Okay, so I'm going to quickly look at the chat here and give you all a break before I get into the implementation business. So what should be considered related to geolocation? I'll address that when I get to the draft framework that we developed for thinking through privacy considerations. Are the rules different in regards to privacy during crisis and emergency situations? Great question, because it leads me, it's like a great segue, because my next question is what rules? That's like a really important foundational question when you're talking with privacy is what rules are we even talking about? What rules apply? What rules are we following? Do they conflict? How are we dealing with conflict? And I saw that someone else here said mandated reporting. Does mandated reporting conflict with privacy rights? Frequently, mandated reporting will say slightly different things than a privacy law, right? Because privacy is saying don't disclose and mandated reporting is saying you must disclose. And so you need to be able to identify, again, what laws apply, do they conflict? Is there an exception that permits mandated reporting? That will vary really state by state, but happy to talk more about it in a few seconds. Okay, so privacy and 988 implementation. We started with needs assessment for NASDAQ members on the next slide. And we asked people who are implementing 988 at the state level, what are your main privacy questions or concerns? And some of these have been reflected in the chat already also. We use this data to help inform the privacy framework that I'm going to cover for the remainder of the session. 75% were concerned about how to share information for linkages to care. Another majority of the respondents were concerned about data sharing with law enforcement, especially for Black, Indigenous, and people of color, and LGBTQ+ communities. And then there were concerns about geolocation, concerns about sharing information with crisis care facilities, and concerns about sharing information for mandated reports. So basically our chat, but just translated onto this slide. So very prescient of everyone. And then we got some good comments from the needs assessment also, and I'll share two of them right now. One person asked how to address privacy concerns regarding law enforcement response, particularly for communities of color. And then the other one was how to address confidentiality concerns if people are calling 988 as an alternative to 911 and do not necessarily want first responders or law enforcement involved. So how do you address the confidentiality concerns of people who are on the call and address confidentiality concerns in your community messaging largely? I thought it was useful for me to see this data because it showed that our concerns about privacy are frequently a bundle of concerns about federal law, state law, oversight requirements, and then questions about technology, practice, and policy. And so hopefully the next few slides will help sort of explain the tool that we created to address this. There's so much variability state by state, but I think that this tool will be useful in any state. And I'll put a link right now into the chat so you can pull it up. Our privacy framework is a way to walk through the privacy considerations, and it has these three core elements. Privacy mapping, which is identifying the legal and policy standards that apply, sort of identifying what you need to know. privacy risk, which is identifying what's at stake for individuals, and then a privacy dialogue, which is really about your accountability to the community. And this can be used to answer the fundamental question: how are we considering the impacts to individuals as we develop our state's 988 crisis response network? I'm going to walk through each core element now. We'll spend most of the time on the first core element. So privacy mapping is about understanding where you're at. What information is collected about callers, what privacy laws apply. I'll cover both of those in a little bit more detail in a second. And then trying to map out how is information going to be shared and how is the 988 call center going to need information later. It's always useful in privacy land to be trying to think a few steps ahead. Oh, shoot, the link to the draft. Yes, I did promise to put that in. Let me add it now.
I just put it in, Jackie.
Oh, thanks. Okay. So next slide. Regarding what information is collected about each caller, this is a useful resource when you're trying to figure out how 988 is collecting information. According to SAMHSA's FAQs, 988 callers are not required to provide any personal data in order to receive services. So you want to be clear that if you are collecting data, the data collection is not a barrier to people who are trying to get help. It shouldn't be, I need your social security number before I can provide you any help, which is literally what my wireless internet service provider said to me the other day. And I was like, there's no possible way that can be true. You do not need my social security number for this. Okay, and then to the extent that you are collecting demographic information, SAMHSA has said it should only be used for limited purposes: saving lives, connecting people to support, and evaluating 988 performance. And then the next slide covers a beginning analysis of what privacy laws might apply. So you're probably going to be thinking about whether HIPAA applies, the Health Insurance Portability and Accountability Act, the general federal health privacy law that we all know. And then you'll also might be wondering when and how 42 CFR Part 2 applies, which is the specific regulations for substance use disorder treatment programs. If the 988 call center is coordinating a lot with community-based substance use disorder treatment programs, you'll need to be thinking about how Part 2 applies and how you'll be complying with it. There may be state privacy laws. There may be ethical duties of confidentiality, professional licensing requirements to maintain confidentiality. These are just the health privacy law landscape. And then there will also be a similar landscape of mandated reporting laws, which are much more state specific. So I don't have a slide on that. Okay, so the second core element here, once you've figured out sort of what laws apply and what information you're collecting, is just to be able to identify the privacy risk. What is the risk of harm? What is the actual risk of harm? And what is the risk of harm if individuals perceive that 988 is not a confidential alternative to 911? So we've seen some social media movement saying, don't call 988, it's just the cops. And I think that is probably not in the best interest, right, of making sure that this is a community resource. So how do you address the community's concerns that 988 may not be as confidential as they're expecting it to be? And then once you've identified the risk of harm, it's useful to be thinking about how to balance the risk of harm. So as someone else put in the chat, there is a risk of not sharing information in some cases. Sometimes people need the intervention. And so how do you balance the privacy risk against other safety risks if the information is not shared? And that conversation is so much easier to have beforehand and not in the middle of a crisis, right? You don't want to be getting into like privacy balancing tests in the middle of a crisis. So really helpful to think it through beforehand about how you're going to balance those interests and sort of train staff on how to make those decisions. Okay, so the last core element, and I think I'm bumping up against the end of time, so I will be speedy and concise. The last core element is a privacy dialogue, and this is about accountability. how is 988 communicating with the community about potential data sharing with 911, EMS, law enforcement? And then how is 988 collecting community feedback about data sharing and taking steps to address it? So that's really just a dialogue, right? You need to be communicating accurate and transparent information and then have a way of accepting feedback. So someone's asked, will the slides be available after the call? Yes. How will a person's private information be stored or discarded after the crisis? That's a great idea that should probably be in the framework, right? Like, what are your sort of data collection, storage, and data disposal practices? And then someone else asked, what privacy confidentiality does 911 offer? And I'm just going to defer and say that's a little outside my scope right now, but I will say that 911 in most states is conduit to the police. So you would say almost no privacy protections vis-a-vis the police with 911. Okay, so privacy resources and accessing the COE, PHI. We've received many questions here about how to navigate confidentiality and first responder deflection. So we have a resource that I want to highlight about like some case examples of how HIPAA and 42 CFR Part 2 may apply to law enforcement and other first responders in crisis deflection. And then I'll end with the slide on how to contact us. And my colleague Michael will share more about that in the roundtable as well. Thank you, everyone.
Jackie, that was excellent. And as you can see by the active chat, this was something that was a topic that was really wanted for a couple of months. So I'm really happy that you joined us today and just explained things and walked us through it. I'm going to open up now to the roundtable. We're going to have Michael Graziano, who's the director of the Center of Excellence for Protected Health Information, from which Jackie's from, and also Dr. Brian Hepburn in a minute. So we'll start with you, Michael. You want to give us a little bit more information about the COE PHI would be helpful for us.
Hi, thank you so much, Amy. My name is Michael, and I'm the project director for the COE PHI. I just want to thank Jackie from our team for her very helpful and informative presentation. So as Jackie mentioned, as we know that confidentiality is key to helping patients feel comfortable seeking and receiving treatment, SAMHSA funded the COE PHI to assist professionals and organizations in understanding and applying the federal health privacy laws and regulations on the job and specific to their task or to their role. Just to clarify, we do not provide legal advice and we don't advocate for, in favor of, or against any of the federal health privacy laws. We're also not funded to address individual state laws, only the federal health privacy laws. With that being said, we have a great team of subject matter experts and we pride ourselves on making complex legal content around these federal health privacy laws easily understandable for our audiences. And we do this through a combination of services that includes national trainings, individualized TA, self-directed learning like e-learning and brief video-based learning, and creation and dissemination of our in-focus resources, templates, and job aids to support implementation in practice. So at this point, I'm going to drop a few more links into the chat now. And the first one is the link to the main page or the home page of our website, coephi.org. The second link is where you can go to sign up for our mailing list to be made aware of any new resources that we release or any new timely information that you need to know about the federal health privacy laws. That's our mailing list link. And the next link I'm going to put into the chat is to the training page of our website, where you can find those self-directed learning opportunities like our set of 4 e-learning modules. These are free and available to anyone, and they include knowledge checks throughout, as well as certificates of completion. So I'm going to put that link into the chat right now. And one more link. Lastly, this is the link through which you can directly request individualized technical assistance from our team of experts. I did put that link into the chat a few minutes ago, but I'm just going to drop it again. And there you go. All right. Any thoughts or questions, anyone?
Michael, I'll just put in a plug for your center.
Thank you.
Myself, I know that I have used your assets a lot. The fact that they're free, really clear and easy for all of us to understand, including myself. And I would just say, if you're at a center on this call, it would be great to have one person assigned at your center to receive this newsletter for new information. It's really helpful. They don't spam you. And everything that I've gotten from it has been something I've been able to utilize with my team. So I really recommend the center, and they're funded by SAMHSA. So they're really kind of plugged in to what's going on around privacy at the federal level. So Michael, thank you so much. Going to turn it over to Dr. Brian Hepburn now from Nashville to also reflect on these privacy and confidentiality issues.
Thank you, Amy. And thank you to Jacqueline and Michael. This is very important information. Also, thank you to SAMHSA for funding the Center of Excellence. In Jacqueline's presentation, she talked about why this matters, and she identified a number of areas of why it matters. But the areas that I really liked was the fact that it centered individuals in the decision-making, it focused on equity concerns, and it addressed stigma. All of those are so important when we're talking about behavioral health. There's been a great deal of misinformation and misunderstanding that has unnecessarily complicated communications that's necessary in good healthcare, and specifically in behavioral healthcare. We see that in the healthcare of individuals, but also in the area of collecting data and in healthcare exchanges. We're often told that behavioral health is too complicated when it comes to privacy and confidentiality, and so complicated that the healthcare exchanges don't want to include behavioral health, and we have to fight to say it's important to include it. The Center of Excellence in its work on protecting health information helps correct the information and the misunderstanding, and addresses that important balance between the privacy risk and the safety risk that's important at the individual level, but also at the more general data gathering level. So thank you for this presentation. I thought it was excellent. Thank you, Michael. Thank you, Jacqueline.
Thank you both, Dr. Hepburn and Michael Graziano. Appreciate both of your reflections, and really appreciate SAMHSA and this Center of Excellence. All right, shall we move on to our next topic? Oh, t-shirts, one of my favorite topics. Here's the good news about t-shirts. If you're a little chilly and you're like, my short sleeve 988 shirt, like myself, I didn't wear it today, a little bit too cold, no problem. We now have long sleeve shirts, mugs, hats, wristbands, all kinds of 988 garb. So check off somebody on your holiday list and get them about 988. And I know we always kind of push this, but for me, I think like for our younger folks, wearing stuff like this gets other adolescents, teens, etc. They're kind of doing marketing for us. It really helps. And so I've gotten my college age kid a couple t-shirts, and it's sparked a couple conversations. So just think about it that way. All right, next slide. Oh, favorite thing, hot seat. Megan Huff, who's the Chief of Staff at Nashville, is joining us today. Hey, Megan, so happy. Thank you so much for joining us and participating in the hot seat. You can get your mug and wristband. So let me read you the question. What happens when you call? Again, remember our new mission, we're really taking the user experience. Individuals who outreach 988 hear a brief recorded message, only about 45 seconds, that offers them additional specialty services before routing them to a Lifeline crisis agent. So it starts with, hi, you've reached the 988 Suicide and Crisis Lifeline. We are here to help. Now, here's the question for you, Megan. What is the next thing that is said? Is it, if you're a veteran, push X for the Veterans Crisis Line? Is it LGBTQ plus and under 25 years old, push X? Is it Para Español, push X, or Native and Strong Line, which is another option? So what is the first thing after they welcome them and have their opening greeting? What do they say first? Shall we ask the audience?
let's ask the audience, Amy.
Let's ask the audience. Okay,
All right.
audience, I think we've got them. Ooh, so what do you make of that choice?
Ooh,
Mhm.
ooh. See, I actually thought
Mhm.
the first was the Veterans Crisis Line.
I hear you.
That was my first. Is Christy Malik on the line?
Ooh. Christy Malik, are you on the line? Let me see if she's on. Is she on?
Yeah, you know what? I am remembering, at least in the past, I believe the first one was veterans, push one for veterans.
Mhm.
I'm going to go with veterans.
I love it. Okay, final answer, Veterans Crisis Line. What's the answer? Oh,
Ah,
okay, but wait a second. I just want to give you a little bit of kudos.
is this
Because
a trick
when you
question?
push, is it, of course, David Covington made it up, but of course it's
Of
tricky.
course.
So the first thing they want to do is make sure you get to the right language, right? So that you can
Right.
understand what's said. Here's the trick to it. The button you push for Veterans Crisis Line is button number 1.
Yeah.
So that's, I'm going to give you half credit for that. So first is Para Espanol, push 2, then Veterans Crisis Line, push 1, and then they move through the other options. Notice that Native and Strong, we've got here that it's Washington State only. Washington State is piloting this project, and also across SAMHSA and the 988 leadership, they're thinking about if there are any other slices that need their own button. Of course, we need to balance. We can't have them listening to 25 different options. They need to get to a crisis worker quickly, but they're thinking about it. But Megan, I'm giving you a half win on that. And choose your mug or t-shirt carefully. And thank you for joining us today on the hot seat.
Thank you.
All right, next up. All right. So we're adding a new something to the jam, and that's going to be Medicaid Corner. And I think we all have been kind of wanting a little bit more of this voice. And so I'm welcoming Jamie Snyder. Thank you so much for joining us today. She's the Director of Arizona Healthcare Cost Containment System, and she's going to give us a few insights from the perspective of Medicaid. Welcome, Jamie.
Thanks so much for having me.
So Jamie, this is Tom. Thanks for joining us today. I think you were going to provide a quick update in terms of what's going on in Arizona. You got a lot of great things going on from the call center and everything else like that. So take it away.
Sure. Thanks so much, Tom. Yeah, I was hoping to provide a bit of an update on some work that we've been doing specifically around our crisis call center. So I think you all know that we have a very mature crisis services system in Arizona that includes 24/7 call center, mobile crisis teams, crisis stabilization units. But up until October 1st of last year, our call center included 2 vendors. There was a vendor that was really responsible for serving Southern Arizona and another vendor that was responsible for serving the balance of the state. And in line with SAMHSA's best practice, where the call center really acts as that hub or that front door, we really felt that it was necessary to move to a statewide crisis call center. So one vendor that's responsible for all of the crisis calls coming into the system. So we really leveraged one of our managed care RFPs to make that happen. And what we did is our what are known as regional behavioral health authorities, which are responsible for providing integrated care to individuals with an SMI designation, are also responsible for the crisis services system in Arizona that's available to all Arizona citizens. So through our RFP process, we compelled the bidders and the awarded contractors ultimately to come together and jointly contract with a single vendor to manage our crisis line going forward. And so we awarded the contract in November of 2019. Shortly after that, the awarded contractors came together. They issued a joint solicitation and ultimately ended up selecting one vendor, Solari, to manage our crisis line going forward. And we were very clear in our expectations with the RFP that crisis line vendor needed to be accredited through Lifeline or 988. So really to create that seamless system from 988 to the state call center where local citizens can really respond to the needs of individuals in crisis when they're calling the crisis line. So again, they issued a joint solicitation, awarded the contract to Solari. We reviewed the award prior to the finalization of award and ultimately approved it through the agency. And since that time, we've seen a lot of success. And when I say since that time, it went live on October 1st of 2022. And now 988 callers around the state are able to seamlessly access crisis line services that connect to mobile crisis teams and crisis stabilization centers when needed. And so a couple of data points, we always like to provide data to substantiate our success when we have it. Our answer rate sits at about 98.8% for the statewide crisis line. Our average speed of answer is 9.1 seconds. And right now, our in-state answer rate for 988 sits at around 95%. So we're always looking to move the needle a little further on that, but pretty proud of where we're at, given that it's only been up and active for a few months. And so just wanted to provide some background on how we leveraged our RFP or our solicitation process to really compel our contracted managed care organizations to jointly contract with one vendor for a statewide crisis line, and happy to answer any questions.
Jamie, we just have a few seconds, but someone said, can you just speak briefly about how you've used Medicaid funding for the line?
Yeah, so we do fund the line solely through Medicaid, but as I mentioned, these services, both the call center services, the mobile crisis team, and the crisis stabilization services are available to anyone in the state of Arizona, so any state citizen. And I was going to say one more thing. I have a couple of my colleagues on the line, Ann, Paloma, and Dana. And Dana wanted me to mention that we do have state appropriations specifically to fund the crisis services that we offer outside of those to individuals outside of those that are enrolled with Medicaid.
Well, we have really appreciated you being the inaugural a person on the Medicaid corner. I know there's a few more questions in the chat. Maybe you can answer them through the chat. Thank you so much for joining us and telling us about more of the innovation being used in Arizona.
Sure, happy to.
So Ren Cohen is joining us today, and I just want to say kind of a special thing about Ren. This whole idea of a lived lens and having this as a kind of a moment that we pause during the calls each week to really take the user's experience and help guide us to the top of the mountain was actually her idea. She's the one who really came up with this idea, and we're also appreciative of it. But we forgot to let her actually talk to us about her story. So I'm welcoming you today, Ren. You're usually behind the scenes. I'm so happy to bring you to the front. And thanks for joining us today.
Thanks for having me. Thank you, Amy. I think this all came up when I started thinking about my family and myself and how things would have been different if we had 988. And I can give specific examples for myself, and I will, but I have 2 uncles who are SMI. I have grandmother who tried to die by suicide twice. She's no longer with us, but that's not how she died. I have a lot of relatives, and then I'm worried too because I have an 8-year-old, and I don't want her to have issues in the future. So I had Allie, and then I went into depression, and then had psychosis. I ended up being diagnosed bipolar with psychotic features. I was in psychosis for months before I got help. in the beginning, it was stigma. I thought I'd be like my aunts and my uncles and I'd live somewhere else and I wouldn't see my daughter and so on. But I tried to get help, and even those people couldn't help me. So I called a psychiatrist's office that's right up the road from me, told them what was going on, and they told me to go to the ER. And I didn't want to do that because of my fears and the stigma. And then my husband convinced me to go to a doctor's appointment, and he had worked with the doctor and told them what was going on and that I wouldn't go to the ER, and they thought this could be a good way to avoid the ER and just go straight to a hospital. But she sent me to the ER anyway. And then so I stayed in the ER for 12 hours or so, which is good considering some people stayed much longer. But it was traumatic, and I just think there was a lot of points where, 988 is really talking to a counselor. And when I was thinking about what help I needed, I just needed to talk to somebody. And I was treated like, because I had psychosis, I was treated like dangerous. And I get the fear, but, I just know that for me and my family, when this happens again for me, or if my daughter has the same issues, that it'll go better, because they say the statistics are like 98% of 988 calls get resolved over the phone, because I think people like me just needed someone to talk to, and make plans that are not the ER or jail. So
Ren, thank you so much for sharing with us. I mean, I've known you for months now, and just have always appreciated your input and guidance on this journey that we're on, all of us together for 988. And thank you so much for sharing your story today. This is why this segment is so important. It brings us back to where we should be, which is at the person level. And so I really appreciate you sharing today. And of course, always look forward to hearing from you again in any capacity. Thank you so much. All right. I know that Stephanie Hepburn is on, and really looking forward to hearing about her interview. Stephanie?
Thanks, Amy. First, I just wanted to say thank you to Ren for sharing your story. You were one of my very favorite people. So your openness and vulnerability was just, I think it's important for everybody to hear. So thank you. So I wanted to introduce Kaveh Serehi. He's the founder and CEO of Emissary Health, a digital peer support platform. And Kaveh, can you share how the platform helps address social determinants of health?
Yeah, thanks guys for the time. This is my first call, so it's been really awesome to see everyone speak and such valuable information. But yeah, like Stephanie said, my name is Kaveh Serehi. We have a digital peer support platform, and we partner with payers to essentially provide wraparound services and provide this digital peer support service. So kind of what it looks and feels like is we have two different models where we either just purely provide the software platform, or we'll provide also the peer on the other end to interact with whatever population is in need of additional service. And really the big kicker here is we want to keep people safe and with their families at home in whatever way we can. And also we want to account for any social determinants of health that may be barriers to receiving behavioral health services, general well-being, preventive care, all these things. So right now we're in 3 states, and we work primarily with populations with SMI and SUD, and we have an awesome team. So we're very excited with what we're doing and building. The software itself is more of a platform in that it provides kind of educational and supplementary material to existing peers, to prospective peers, to the populations they interact with, and they can go through that material side by side. obviously HIPAA compliant and private. I know privacy was, sorry, I'm trying to read these questions as they're coming in. I'll answer them at the end. Again, like privacy was such an issue that we talked about earlier, and that folks can feel secure and safe with who they're interacting with and the platform they're on. So obviously that's a big topic for us. And when we think about HIPAA compliant chat and video function, we also have scheduling functions so peers can set their time and place and all these things. And then when you're going through that content, it includes like video, interactive content, animated designs. And then as you go through those things, you'll set a wellness plan, daily strategies, your kind of quick contacts to go through or to go to when you're feeling distressed or you have, feelings of using or any of those things. So that's where we're at. And I've talked about this with Stephanie, is that if you look at our website, it's a little vague. And it's intentionally that way because we do think peer support in general is very valuable. So what we're kind of working with our payer partners now on is peer support for populations of SMI and SUD, but also how can we support foster youth? How can we support caregivers that are experiencing, very, very high levels of burnout, and how they're supporting their family members with SMI and SUD. So we're just really excited about what we can do with this technology in our team.
Can you share just really briefly, when we look at when we look at health tech generally, it feels like behavioral health is marginalized in that regard. There's not as much attention with 988, there's more attention. But to focus on peers, it's such a vital area, but often ignored. What made you go, when you're looking at your health tech and decided to launch this, how did you decide to focus on peers? And if you weave in a little bit about the social determinants of health component that was vital to you?
Yeah, absolutely. So how we started with the populations we're looking at is one of my co-founders and partners is Dr. Karen Fortuna at Dartmouth. And this has really been the core of her research for years is the impact that digital peer support can have. And then also, obviously, Karen teaches at Dartmouth different classes, and she's a PhD in social work. So she's also very interested in how this affects social determinants of health. And in general, when we talk about behavioral health services, when you have a population that doesn't receive the proper funding, the proper attention, or the proper spotlight, then social determinants become even more exacerbated when you don't get vouchers for things like rides to and from any kinds of appointments, when it comes to getting groceries, when it comes to adhering to a medication plan, or even just like translation services. Mm-hmm. So this is really where we focus, and we really want to match and pair people one-on-one with folks that really understand where they're coming from, and they have that lived experience, and they can also assist with things that all these small little kind of chains that lead to a really big impact for someone's long-term health. So that's where we sit. That's what our passion is. And hopefully we can make as much impact as we possibly can.
I love that. And I think it's, it gives also peer support specialists an easy way to coordinate the people that they're working with, and people who are struggling can quickly schedule. So it's just going through the format. Anyway, go to the article, check it out. I love what you're doing, and thanks for hopping on the call with us.
Yeah, absolutely.
I'll pass it back to you, Amy.
Thanks, Cav. There's some questions in the chat for you, Cav, so you can check them out. Thanks.
I'll work through them. Thanks, guys.
Okay, John Palmieri, let us know what's going on at SAMHSA these days.
Hey, Amy, thank you. And thank you for this last segment. I really appreciated both the kind of amplification of peer supports and the many intersections with social determinants, which, as we know, are critically important in addressing people in crisis and preventing crisis encounters in the future. So really appreciate kind of amplifying that conversation. So we're busy, Amy, we're busy. So there's a lot going on. I know you did flag the outage earlier in the talk here, so just wanted to convey, certainly appreciation, because a lot of people reached out to us, concerned, offering help. and support. So very much appreciate that. I mean, obviously we don't plan for these things, but at the end of the day, it will help us make the system stronger. And people rallied in an incredible way to mitigate the challenges, to come up with solutions, and to get things back up and running. So very happy about that. And again, continuing to work towards strengthening the system, because at the end of the day, we want there to be public trust in the system so that people feel comfortable accessing care when they need it. Also wanted to just highlight that we are kind of connected to that. We'll be coming out with our October, November data. There was a little bit of a lag time there, but we'll be publishing that shortly in line with our desire to continue to be transparent about system performance. And then also wanted to let people know, I think a lot of people on the call probably are aware that we are going to be holding another national convening, a virtual session next Tuesday. I'm happy to throw the registration link in the chat here, but this is really intended to be kind of a continuation of a conversation on how 988 is really that catalyst for transformative change across the crisis continuum, and where are the various levers that we need to be leaning on, both within the federal government and in partnership with all of you, to drive sustainability, workforce changes, technology, data, equity in the system. And so looking forward, there's just a tremendously impressive panel of folks coming, many sessions that are planned that I think will provide some rich discussion and optimally some specific steps for action moving forward into 2023. So very much looking forward to that. I think that's it for now, Amy.
Thanks so much, John. Thank you so much. You're right. You are busy over there. All right. We're turning it over to Arlene Stevenson for the NASHPIT update.
Good afternoon. Glad to be here with all of you. I just wanted to spend a couple of minutes with you to tell you about a new initiative we've been working on for a few months. We've been developing a behavioral health parity playbook. The topic is strengthening state laws and partnerships. As you're aware, there's been a tension for quite some time between insurance companies wanting to manage care and costs, and the need for individuals to be able to access behavioral health services that they need and that they have the right to. Parity basically is equity. It's equity in insurance payments. The goal is that behavioral health services would be reimbursed at the same level as physical health, and that consumers would pay the same copays, deductibles, other cost sharing as they would for physical health. We need to continue to pursue this because parity is an important component of financial stability for crisis services. A lack of parity causes a lack of revenue sources, in short. So are you thinking, what will the playbook do for me? Well, the playbook begins by explaining several federal laws that drive compliance and enforcement. And they are very complex. So we've tried to put them in basic English so that everybody can understand them. It also highlights 4 states, and they have taken different approaches to parity. So it's interesting to see what the differences are. They also describe state parity laws in 10 states. States should always look to the federal laws because they are the federal laws. But some states have built on the federal laws by filling holes in their own laws, things where they feel their laws are weak. There also are states, and we looked at 11 of them, who have been enforcing compliance through monetary penalties, and that will provide you with some information on what went wrong that they were fined, and how much were they fined, those sorts of things. And then we also have provided a list of the most common parity violations, so that you'll know what to look for when you're doing your own assessments. There are many roles that a state behavioral health authority can play in helping achieve a parity. A couple of those are helping consumers know their rights by participating in some national groups where you learn things, a lot of things, but one of them is how to do parity assessments, for example. And most importantly, how states can partner with the other parties in their states who have some responsibility for parity, such as the insurance commissioner, the attorney general, and the Medicaid programs to further their parity issues. So it's coming soon. And so you remind you of the name again, it's called a Behavioral Health Parity Playbook, Strengthening State Laws and Partnerships. Thank you.
Arlene, thank you so much for the NASHBID update. Looking forward to that document. Okay, I'm going to turn it over to Sarah Corcoran and Joanna to give us our federal update.
Thank you, Amy. And if we can go to the next slide, just very quickly, we debuted this new slide last week about what crisis provisions might be on the table if an end of year package comes out of Congress before we start the new one. So I'll let you peruse that in anybody's free time if you want to dig into the details. But the two updates since last week, one, the fifth and final draft from the Senate Finance Committee was released, and that was on parity as part of their mental health process. And I will share the link to that in the chat. And then two, overnight, we saw in the National Defense Authorization Bill, a report, or basically a briefing to Congress is going to be required by March to share how TRICARE covers behavioral health crisis services in the defense space. So I'll also put a link to that. If I can share the language, I will, but otherwise I'm going to turn to Joanna. It's a nice step forward in coverage of crisis care.
All right, so yeah, looking ahead to next year, I just want to briefly touch on the midterms. It's finally official after last night's runoff election. The Senate is being held by the Democrats, and as we all knew, the Republicans took a House. This is going to cause some shifts in leadership, which we're expecting to see finalized over the next few weeks. On the Senate side, Senator Schumer is going to remain the majority leader, and we are expecting McConnell to remain the minority leader. The House side, we know that Pelosi did relinquish her control over the Democratic side of the House. So when the Democrats switch to the minority next session, we will see a new Democratic leader, which will be Hakeem Jeffries. And then on the Republican side, we are sort of waiting to see how that rolls out. Representative McCarthy, excuse me, is too many mixed. Is receiving some challenges to his bid for Speaker. So we'll see how that all rolls out, and it'll be very interesting to see how the shifts in power impact mental health and 988 specifically. And thanks, Amy. Sorry, that was a little bit longer than I meant.
No, that's great. You know, I know we're all wondering what the impact of these shifts are, and we're so grateful to you and Sarah for keeping an eye on that and sharing with us every week, because of course none of us can keep up with all the details. So I always appreciate your summaries and your vision for what's coming up. So thank you for that today.
Thanks, Amy. All
right, we are not going to have a state update today because there really hasn't been many changes, but we'll look forward to that next week. So a new episode just dropped last night, Rihanna Chang and Kane Moto. Please check those out. They really are just really compelling. And in fact, I know David Covington shared with me today that he will be at NatCon on the stage sharing a number of the first 3 episodes of this series and talking with actually the speakers and the storytellers from those. So if you're going to be at NatCon, look forward to that. Next slide. Right, so we saw a little bit of the trailer at the opening today. So as we wrap up, I want to say a couple things. I want to thank Jacqueline Seitz, Michael Graziano, Brian Hepburn for their input today. Also, Jamie Snyder for kicking off our new Medicaid corner, Megan Hopp for the hot seat, Ren Koenig for visualizing the lived experience, but also sharing today, and Kav Sadihi. And then I want to tell you, we got 2 weeks off for you to celebrate the winter holidays with your family and friends, but we will be back on January 4th and you will not want to miss it, because we're going to have a whole segment really focused on youth crisis guidelines. And I know a lot of you want to know about that. We'll have the presence of Dr. Everett and Dr. Shaw, who is a senior advisor at SAMHSA. And so I really hope that you'll be back and ready to rev up for 2023 on January 4th. Thank you all for an incredible 2022. Really looking forward to seeing all of you in 2023. All the best, Jammers. It was great to see you today. Bye-bye.